And now it is my absolute pleasure to welcome Robynne Chutkan. Dr. Chutkan is an integrative gastroenterologist. She's the founder of the Digestive Center for Wellness. She's also the author of many digestive health books, including Gut Bliss, The Microbiome Solution, and The Bloat Cure. And watch for The Antiviral Gut, which is going to be released in the fall of 2022. So for anybody joining us on live stream, we'll get the link up so you can register to join us here on the main virtual stage. And that way you can ask your questions after this presentation. And now I will turn the stage over for you for creating an antiviral gut.
Thank you so much, Maggie. It's such a pleasure to be here. So thanks so much to Trust Transparency and Whole Foods Magazine for having me. Let me share my screen with you and we'll get started. So in medical school, nobody wanted to do gastroenterology back in the late 80s and early 90s. So I am delighted that the gut is having a moment. Back then, it was all about orthopedics and dermatology and ophthalmology. And as I like to remind people, your gut is your engine for your entire body. And it turns out that includes your immune system and some other important organs too. So let's go ahead and get started in talking about how to create an antiviral gut. And I'm just going to move myself over here so I can see the slides. And this is really one of my favorite quotations from Hippocrates. Everybody knows all disease begins in the gut, but this idea of what sort of a person develops disease versus what sort of diseases a person develops, I think is really a helpful way to look at how illness and disease develop. And that really leads us to the question of why. And it's a question that is not really well addressed in medical school. You know, we were very focused on what. Is this ulcerative colitis or is it Crohn's disease? Or these gallstones or is this an ulcer? But why? And when we think about viral illnesses, why do some people get exposed to potent pathogens and never even get infected? Why do some people have mild symptoms while other people end up in the hospital or even succumbing to the disease? We know that 10% of people of European ancestry are completely immune to HIV. No matter how many times they get exposed, they will never develop HIV and AIDS. So what are some of the factors that lead to viral resistance and susceptibility to viruses? If we think back to the early days of germ theory, there's Louis Pasteur with a beard on my left and Antoine Béchamp on the right. And so we're all familiar with germ theory, the idea that an organism gets into your body and makes you sick. And that is absolutely the case. We see germ theory at work all the time. People get exposed to the flu or to coronavirus, they end up with influenza or with COVID. So we wash our hands and we social distance because of germ theory. But Antoine Béchamp, around the same time that Pasteur was popularizing germ theory, talked about this idea of terrain theory. So in other words, the idea that it's the soil, not the seed, not the germ, but the soil and the health of the soil that can determine whether that seed will germinate and cause disease or whether it will pass harmlessly through the host. So when we think about terrain theory, we think about what we do to keep our immune system and our general ecosystem healthy. And much of that soil is actually our gut. We're talking about our gut health, microbial health, immune health. If we think about host health, we know that host health makes a tremendous difference. We've seen it with this pandemic, that extremes of age, the very young, where the immune system is still developing, and the very old, where the immune system is waning rather, are definitely at increased risk. We know that comorbidities like having obesity, we know that medications that people take, immunosuppressive medications, can play a big role in people's susceptibility. And if we look at comorbidities, we see that in terms of diagnosis with COVID, about equal numbers, 51.7% of patients with a comorbidity like high blood pressure, heart disease, asthma, are diagnosed with COVID, versus 48.29% of patients without a comorbidity. But when we look at deaths, we see a very different picture. We see that patients without a comorbidity, that their rate of mortality was only about 16% versus a much higher rate for patients with a comorbidity. So this is an example of terrain theory at work. The health of the host matters greatly. We know that gut microbes can predict severe COVID-19, and we know this from a University of Massachusetts study in 2021 that looked at a large group of patients with COVID and found that the composition of the microbiome could predict severity, outcomes, so respiratory distress and even death, with 92% accuracy. So this is more accurate than factors like age, gender, comorbidities, even inflammatory markers like C-reactive proteins, et cetera, than all those factors combined. So really what I'm saying here is that a smear of stool from the rectum could predict outcome from COVID-19 with more precision and accuracy than every other factor that we have been looking at. And when we drill down a little bit to see, well, what is this incredible predictability? We see really two organisms. My favorite bacterium, Faecalibacterium prosnitzii, not just because the name sounds fantastic, but because this is the most prevalent bacteria in healthy hosts. It's highly prevalent in vegans, but you actually don't need to be a vegan to cultivate Faecalibacterium prosnitzii. You just need to eat a lot of what these bacteria eat, which are primarily indigestible plant fiber. And in this study, the UMass study from 2021, what they found is that people who had better outcomes had higher levels of F. prosnitzii. And again, F. prosnitzii is not just protective in the setting against COVID, but we've known for a long time that this is an organism that protects against metabolic diseases, against cardiovascular disease, against colon cancer, and now we know against viral illnesses. What about the organisms that were negatively associated? Well, Enterococcus faecalis, the higher the levels of Enterococcus faecalis, the worse the outcomes. So again, Enterococcus faecalis, bad, F. prosnitzii, good. Now, I'm always hesitant to label bacteria good or bad, because if I asked for a show of hands of everybody on this call who is good, and then a show of hands for everybody who is bad, many of you would be like this, like me. I could be very good sometimes and sometimes not so good. And the same for bacteria. So we know that the metabolome and metabolomics are vitally important. And it's not just the presence of certain species of bacteria, but it's really what they are producing, their metabolic byproducts. But for the purposes of this study, it was really, again, we could predict with 92% accuracy the outcomes based on the levels of F. prosnitzii, Enterococcus faecalis, and there were a few other organisms also. So as I like to say, it's less about the potency of the pathogen and more about the health of the host. But why is a microbiome so predictive? Why is it so accurate? Well, it's because of all the things that microbes do. These are just a few, sort of the top 6 list. They digest food, they synthesize vitamins and hormones, things like vitamin K. We see this all the time in the hospital when people are on broad spectrum antibiotics. And the phlebotomist will say, look, this person's blood isn't clotting anymore. They need some vitamin K because the antibiotics have wiped out the bacteria that produce the vitamin K. So they are integral in synthesizing vitamins as well as hormones, neurotransmitters. We know, for example, that about 80 to 90% of serotonin, the feel-good hormone, is manufactured by gut bacteria in the gut. Microbes train our immune system. They tell our immune system when to respond, when to stay quiet. They help distinguish between friend and foe. They modulate our genes. We know that they actually can inactivate certain genes and activate others. They protect against pathogens, is another important job. And really, through all of this, they influence disease expression, not just disease like COVID, in other words, whether or not you actually develop COVID, but also cardiovascular disease, autoimmune disease, et cetera. Your complement of gut bacteria are critically important in deciding and determining whether those diseases that you may have a genetic predisposition for actually come to fruition. So again, I'm a little wary about this good and bad bacterial flora designation, but for the purposes of our talk today, of our time together today, if we think of good bacterial species, we think of organisms like bifidobacteria that we're born with, if we're fortunate enough to be born vaginally, especially, and we swallow a mouthful of our mother's microbes as we really exit through the birth canal. So the bifidobacteria often are founding species. We know certain types of E. coli can be helpful, lactobacillus, And when we think of bad bacteria, we think of Clostridial species, Clostridium difficile, which kills thousands of people in the US every year, not just in hospitals, but also community acquired C. diff. Although again, Clostridial species can be helpful. So it depends on the metabolites and which particular species we're talking about. Enterococcus faecalis that I just badmouthed a minute ago in the previous slide, and Lampylobacter. So we have lots of other examples, but this is just for the schematic purposes. I want to show you what happens with the process of dysbiosis, of really imbalance in the microbiome. So we know that in the normal gut, we have typically a good balance, mostly anaerobic bacteria, and a good balance between bifido, lactobacillus, et cetera. What happens with antibiotic usage, with a poor diet, with lack of exposure to nature, with a highly pesticized food chain, with all the different things that can create dysbiosis with too many proton pump inhibitors that my colleagues are fond of prescribing, is that you start to see a reduction in the normal amount of anaerobic flora in the gut. That decreases even more in sort of the second stage. In the third stage, we start to see active reproduction of aerobes and opportunistic organisms. And then in the fourth stage, we see the bifido and the lactic acid bacteria decrease dramatically. And again, active reproduction of yeast species and other sort of pathobionts. So not necessarily pathogens in the sense that, we're not getting colonized with Ebola, but we are overgrowing organisms that should be represented in much lower numbers. So if you think even of something like yeast overgrowth, yeast are normally present in the digestive tract. They play a pretty crucial role in digestion, but when they're overrepresented, which happens after a course of antibiotics, as you know, when the healthy essential species are wiped out, now we have a problem. So a lot of dysbiosis is this issue of pathobionts. They are part symbionts, part pathogens, and they really become pathogenic when they're overrepresented and their active metabolites are overrepresented also. And the problem from a sort of patient-physician perspective is that patients come in wanting to seek out and destroy all these bad bacteria, and having to explain to them that in the process of doing that, you're also going to wipe out a lot of healthy species. So you're going to be digging yourself an even deeper hole. And so focusing a lot on repopulation rather than eradication, and particularly for conditions like SIBO, like small intestinal bacterial overgrowth, is really important. So again, an example here of normal on the left with large amounts of bifido and lactobacillus, and then a dysbiotic gut on the right with higher levels of Candida, Klebsiella, Streptococcus, E. coli, et cetera. Again, all things that are normally present, but overrepresented here. The symptoms of dysbiosis, this is where I come in. So this is what I see in my office all the time. Flatulence, belching, abdominal pain, decreased appetite, a change in bowel habits, sometimes too loose, sometimes people are constipated, nausea. But if we think beyond just the gut, we see that dysbiosis has far-reaching implications on pretty much every organ system. So dysbiosis is at the root of many autoimmune diseases like inflammatory bowel disease, the diseases I treat, Crohn's and ulcerative colitis, non-alcoholic fatty liver disease, atherosclerotic heart disease. It turns out many arrhythmias. I was just reviewing the literature on dysbiosis and atrial fibrillation, one of the commonest cardiac arrhythmias, I think possibly the commonest. And so, thinking about something like AFib as a gut-based disorder is a completely new way of looking at disease. We know that certain kinds of cancer, colon cancer in particular, pulmonary disease, allergies, asthma, atopic type reactions, other autoimmune diseases like rheumatoid arthritis and ankylosing spondylitis. And we know that even brain disorders, certain forms of autism, Parkinson's, mood disorders seem to have their birth, if you will, in the gut. And we know that there is bidirectionality between the gut and the brain. The gut influences the production of neurotransmitters. I talked about serotonin, but also dopamine, GABA, lots of other neurotransmitters are also co-produced in the gut. The gut can influence mood, stress, and anxiety. We see these symptoms in lab animals. We can induce anxiety in lab mice by infusing them or inoculating them with a big dose of Campylobacter jejuni, one of the most common foodborne illnesses. And I see the same results in a lot of my patients with post-infectious irritable bowel syndrome, where after a foodborne illness or traveler's diarrhea, they will start to develop symptoms of anxiety. So we know that a lot of these mood disorders, or even some studies looking at schizophrenia and schizoaffective disorder, have their root in the gut. And similarly, the brain can influence gut motility, secretion, nutrient delivery, microbial balance. So it is very much a two-way street. And we know that the enteric nervous system, the second brain in your gut, has about 7 times as many nerve cells as your spinal cord. So what we're really interested in today is this idea of preventing viral infections or increasing our resistance to them through what's going on in the gut. So let's take a look at the immune system, because when people talk about boosting the immune system and immune health and so on, and even in medical school, I don't think I had a really good physical sense of where the immune system is located. So it will come as no surprise to you that the majority of your immune system is located in your gut, about 80% of it. And with this schematic, what I like to show is that there is just a 1-cell lining, a layer 1 cell thick, a razor's edge, separating the trillions of bacteria and other organisms in the lumen of your GI tract from the immune processes going on the other side of that epithelial layer. And so that epithelial layer, that gut epithelial layer, is really critical. And so are the gut bacteria, because of course they are really modulating that immune response. When we look at what we need to happen for a healthy immune response, it really is fairly simple, despite the immune system itself being very complex with natural T killer cells and T helper cells and plasma cells producing antibodies, et cetera. And, innate immunity and acquired immunity, which is also known as adaptive immunity. The actual process for how you keep this all running, how you keep the train on the tracks, boils down to really a couple simple steps. Ingestion of dietary fiber by us, the host, fermentation of that fiber by our roommates, our microscopic roommates, organisms like F. brusnitzii, and production of healthy metabolites like short-chain fatty acids. And short-chain fatty acids are really key to maintaining the integrity of the gut lining, to really allowing the vitamins and minerals, the hydration to come through the gut lining into the bloodstream, but to keep out the undigested food molecules, the toxins, the pathogenic bacteria and viruses. Without healthy complement of short-chain fatty acids, that process really goes amok. And similarly, for the immune system, I like to talk about this Goldilocks immune system. So an overactive immune system, if you look at the stuff on the left, so at the top, autoimmune diseases, an overactive immune system, when it comes to internal threats, will lead to autoimmune diseases. So basically, that's your body responding inappropriately to your own healthy tissue. And in the case of inflammatory bowel disease, the conditions I treat, it's over-responding to normal gut flora. In the case of rheumatoid arthritis, it's the joints. In the case of psoriasis and eczema, it's the skin. So it is your body mounting an immune response, not being able really to distinguish between self and non-self. That's the internal threat. External threats for an overactive immune system will result in food allergies or very extensive reactions to wasps and bee stings, like anaphylactic type reactions. And when we think of an underactive immune system, we think of, again, internal threats on the left, a loss of the body's normal cancer surveillance system, which is conducted by the immune system. So you think of cancer as an internal threat. And in terms of external threats, of course, infection from viruses, from bacteria, from fungal organisms, from parasites, et cetera. So we want a Goldilocks immune system, not too active, not too inactive. And when we think about a Goldilocks immune system in the setting of this pandemic, we know that many of the people who have tragically died, really not so much as a result of the virus, but as a result of their immune system's response to the virus, with cytokine storm, with a really tremendous and overwhelming immune response that really activates too strong a response and leads to destruction of tissues and organs. And so there's never been a better time for a Goldilocks immune system, quite frankly. I want to tell you about 2 studies that are oldies but goodies, and I think really frame the importance of the food the microbiome, the end result in terms of immunity and resistance to disease. So this is a study that was done by Paolo Leonetti, a pediatric gastroenterologist from Florence, Italy. And he looked at infants in Florence, Italy, and compared them to a similar group of infants in Bulpon, Burkina Faso, in Africa. These were infants from the Mossi ethnic tribe who still lived and ate very much like their Neolithic ancestors, with eating a high fiber diet that was grown locally, typically right around the huts where they lived in the village, and with very little animal protein. An occasional termite during the rainy season, or very rarely a free-range chicken running around the village would end up in someone's pot. The kids in Florence, Italy were eating really a standard American diet, lots of ossobuco and gelato and pizza. So as you know, in Italy, they've really strayed away from the Mediterranean diet and now eat something more similar to a standard American diet with high fat, high animal protein. So these two groups of children were very, very similar at birth. Groups were all vaginally born and breastfed and had very similar microbiomes. But as soon as the children graduated, as they became toddlers and they graduated to table food, everything changed dramatically. The Italian kids started to develop microbes that were associated with obesity and inflammation, and they had low levels of short-chain fatty acids. The kids from Burkina Faso, who were eating, again, a high fiber, unprocessed diet, had species that were associated with leanness and anti-inflammatory. And really importantly, they had more than double the levels of short-chain fatty acids, those important metabolites that not only keep the gut healthy, but keep our immune system balanced. So what's really interesting about this study is that neither group of kids were sick. These were young toddlers, but we could already see the foundations for disease and for susceptibility to viral illnesses in the Italian kids based on their diet, the microbes they were cultivating, the low levels of short-chain fatty acids, and the reverse in the kids from Burkina Faso. This is another study that I think is a great corollary to that study, because you could say to me, well, that's really interesting, Dr. Chutkan, but the kids in Burkina Faso were also living in a very rural environment, and they were exposed to soil microbes every day. They lived with the animals in the huts. So maybe it was environmental differences that were responsible for these significant changes in the microbiome. So this was a study from Harvard where they took 9 volunteers and they put them first on essentially an Atkins diet, pork rinds, prosciutto for snack, high animal protein, high fat diet, lots of cheese and meat. And they looked at the microbiome before, during, and after. And then they rested those same volunteers in the same environment for about a week. And then they put them on a plant-based diet, jasmine rice, lentils, and I believe mango for snack instead of pork rinds and prosciutto. And they looked at the microbiome, and everyone expected things to change, but people were surprised by how quickly things changed. Within about 30 hours of food hitting the gut, the microbiome started to change dramatically. One of the biggest changes was a decrease in the bibliophilia, the bile-loving bacteria. And so these are bacteria that are involved in breaking down animal products, animal protein, animal fat, but they're also associated with diarrheal disease and inflammation. So they saw the changes very quickly. And the other unexpected thing is that they saw lots of genetic changes. They saw genes being turned on and off based on these changes in the microbiome. So to me, it's such a message of optimism, the idea that really it's not our genes that control our destiny. It's the choices that we make every day, primarily what we put on our plates, the medications we take, the environments we're exposed to, and that we really are in the driver's seat and have a tremendous amount of control over whether disease, including viral illnesses, develop or not. Another favorite study is from the American Gut Project in 2018. As you know, this is the largest human microbiome study ever done, over 10,000 people in about, I think it was 47 different countries. And the conclusions from this study was this magic number of 30 plants per week, 30 plant foods. People who ate 30 or more plant foods per week had a vastly superior microbiome in terms of the diversity and the robustness, the richness, compared to people who ate 10 or fewer. And it didn't matter whether you were vegan, vegetarian, flexitarian, omnivore. It really mattered how many plants you ate. So there are plenty of vegetarians who just eat sort of carrots, peas, and broccoli as their vegetables, and they don't eat anything else. So they would have been in that less than 10 category of unhealthy. So eating a greater diversity of plants leads to more gut diversity, which leads to better health. And I have a 1-2-3 rule I use with my patients: 1 vegetable in the morning, 2 at lunch, 3 at dinner. But now I've changed it ever since the study came out, and I tell them it has to be 6 different vegetables that they eat throughout the day. Are we a bit stuck here? Let's see. There we go. So if I asked you what the biggest predictor of health was, you know the answer. But I think if we ask most people, including physicians, and we say, is it obesity, heart disease, diabetes, asthma, cancer, advanced age, autoimmune disease, metabolic syndrome? Certainly, these are all risk factors for severe COVID. But again, the root cause for all of this is really what is going on in your gut microbiome. Of course, we have other defenses besides the microbes and our immune system. We have other gut defenses. We have stomach acid, which we know is critically important, not just for digestion and for assimilation of nutrients, but also for denaturing and inactivating viral proteins. So when I tell my patients, and we have data, we have a large study of 54,000 patients, a population-based study of 54,000 people from 2020 August that showed that people who are taking proton pump inhibitors were twice as likely to be diagnosed with COVID. And people who are taking proton pump inhibitors twice a day were up to 3 or 4 times more likely to be diagnosed with COVID. And my patients would look at me blankly and say, well, what's a connection? The connection is stomach acid. You need stomach acid to digest food, and you need stomach acid to also denature viral protein. And you also need stomach acid to maintain the natural gradient, microbial gradient in your intestines of very little microbial activity in the upper GI tract and much more microbial activity as we go down towards the colon, based in large part on the pH of the gut, with low pH, high stomach acid in the upper tract and the opposite in the colon. So a crucial part of our gut defenses. Another is a gut lining, which I talked about. That 1 cell layer thick is really important for preventing viral entry. And so if we look back at Enterococcus faecalis, we know, for example, that that's a bacteria that can penetrate the gut lining and enter the bloodstream and run amok and lead coronavirus, lead SARS-CoV-2 in with it. So maintaining a healthy gut lining through avoiding things that can harm the gut lining, like nonsteroidal anti-inflammatory drugs, having a robust complement of gut bacteria, and even thinking about the mucus lining. Mucus is critically important. Mucus, as you know, is like a cross between Jell-O and glue, and it traps toxins as well as pathogens like SARS-CoV-2 in its sticky matrix and then expels them. So these are all things. And even though you might think of mucus as being sort of from the oropharyngeal area and more pulmonary, we know that the majority of mucus is actually made in the gut. So these are all important other gut-based host defenses. When I think about a healthy gut shield, and when I advise my patients about this, it is really starting with the foundational aspects, which is a high fiber diet. And again, there's definitely room for some animal protein or animal fat on your plate if you choose to have some. But what is really non-negotiable is the fiber. High fiber diet, both prebiotic foods as well as sometimes postbiotic foods in terms of or rather symbiotic foods in terms of things like fermented foods, sauerkraut. So symbiotic foods, as you know, are both prebiotic and probiotics, because when cabbage, for example, from sauerkraut, in that process of fermentation, you're producing healthy lactobacillus, and you're also providing fiber to feed the gut microbes. So high fiber diet, fermented foods, intact stomach acid, intact gut lining, that all leads to a robust and diverse microbiome and a healthy immune response and resistance to illness, including viral illnesses. So I think that's all I have for you this morning. I have pictures of the 3 previous books, gut bliss and microbiome solution in the bloat cure. And I'm super excited for the antiviral gut, which will be out November 1st, and really expounds on this idea of our soil and how to have a healthy soil so that we can be resilient to viruses, not just this one, but all the other ones coming down the pike. Thanks so much.
So excellent. Thank you so much. I've actually my phone has been blowing up with text of people just saying how much they're absolutely loving your talk. So thank you. We covered a lot of ground there. And one of the takeaways that I really love from what you said is just, we often hear from people that it's so hard to get healthy, making those lifestyle changes is so hard. So I loved what you said with the research with the 30 hours, like you really can take steps today and you're on the path to better health right away. So I find that very encouraging. So
thanks, Maggie.
We've had a few questions come in that kind of get to the point of lifestyle factors and what's needed. So I love your motto you've talked about in the past about live dirty, eat clean,
yes,
which really comes into play with immune health and wellness and the lifestyle. Can you just give us an overview of that?
Sure. And I'll mention here one of my favorite books. I love promoting other writers. So James Clear's book, Atomic Habits, he talks about the input, managing the inputs, and the outputs will take care of themselves. And I was reflecting on this when I was writing the antiviral gut and thinking, I don't spend a lot of time worrying about getting sick. It doesn't mean I won't get sick, but I don't spend a lot of time worrying about it because I channel that energy into doing the things that I know, like creating a system that I know will make me more resilient to illness. And for me, it's a really simple dirt, sweat, veg. So I try and get outside in nature every day. And I literally can be seen hugging a tree in Rock Creek Park. I try and come back a little bit dirty. I try and get sweaty. And if I can combine those two with the trail run, even better. And then I try and eat some vegetables. And I'm not necessarily counting, is it 6 servings? Did I steam them? Did I roast them? Did I fry them? I'm just trying to get them in. I'll often blend them in a green smoothie. And so that, yes, there are lots of other things you can do, but those 3 are really my ride or die, dirt, sweat, veg. And I think it's important to have that system, that consistent system that can really help you. I mean, of course, we all, there are other things that we need to pay attention to, our sugar intake and our alcohol intake, et cetera. But, eat more vegetables is a big part of mine, and get dirty and sweaty.
I love that. Your ride or die tips. Excellent. I wanted to talk about, as an integrative gastroenterologist, that's a mouthful right there. So you're taking a different approach than most other GI practices. Can you just talk about some of the key differences?
Sure. And full disclosure, integrative gastroenterologist is just a term I made up. I think it was literally on the fly and one of Dr. Oz's parents. And I was like, yeah, what that means is I'm interested in the rest of you too. I'm not just siloed with your gut. And I'm also interested in the connection between the gut and the brain, and the gut and the lungs, and the gut and the heart, and the gut and the immune system, and all these other things. But really, I think the biggest difference, Maggie, is that I spend a tremendous amount of time on prescribing medication that my colleagues, my GI colleagues, as well as my derm colleagues, my OBGYN colleagues are prescribing. So for example, proton pump inhibitors, still some of the most commonly prescribed drugs in the world. They're great for helping with reflux symptoms. It means you can eat a cheeseburger at 10 o'clock and feel fine, but that's a problem. You shouldn't be able to eat a cheeseburger at 10 o'clock and feel fine. That feedback that your body gives you, like not so good, is important feedback. And when you block it with a proton pump inhibitor, it means that, yes, you can sort of, take the reins off in terms of some of these habits, but it also means that you're potentially doing damage. And again, most of these drugs are, I'm very glad that we have these incredible drugs like proton pump inhibitors and steroids and biologics. But what I'm seeing is that they're not being used judiciously. And it's this idea of a pill for every ill. And so I try to get patients to think more about root cause, what they're doing to cause the reflux symptoms, and how they can stop doing that rather than whack that with a drug. And then you have to whack the side effects of the drug with another drug. And then pretty soon you're polypharmacy and you don't even know what's causing what.
Yeah. And I know you've been working hard to spread this message and to educate the public, and I imagine, practitioners as well. One of the things that came up yesterday in a talk was that, a doctor that we was saying they never even said the word microbiome in medical school. Like it wasn't discussed at all. Is that changing? Is the medical community getting the message now? Are we going to maybe see integrative gastroenterology as a specialty now? Hopefully it catches on.
Well, Maggie, I was really interested in that poll, and I noticed that, the change for physicians, it was 5%. 5%. And so what that really tells me, and what I've seen, is that we are not the ones leading the revolution. Consumers are, retailers are, publishers are. So really, it's a lay public. And, when I say lay, I mean non-health professional, but people in very specialized industries. So it really is. I mean, the New York Times is breaking a lot of these articles, these news breaking articles. I mean, there's a fascinating article about the use of antibiotics and a drop in global cognition in women, in middle-aged women, that was equivalent of 3 to 4 years of aging. And so the wonderful thing is that the average person has access to all of this information through the internet, through great publications like yours, quite frankly. And so what we've seen is that the flow of information is bidirectional, but I would argue that the flow of information right now is probably from the patient to the physician rather than the opposite way around. And I'm always telling people, don't break up with your doctor unless they're just a total jerk. But I want you to educate them and bring them along, because I was educated and brought along by so many of my patients when they started using food as medicine to treat their inflammatory bowel disease, which I thought was terrifying until I saw that it actually worked. So we have a great opportunity, all of us, to educate each other, including our healthcare professionals, and to be leading this charge towards, to me, it really is an issue of empowerment. And I do think that the medical industrial complex has made people feel hopeless and helpless, and quite frankly, like there's nothing they can do. And so to my message is always, look, there's so much you can do. Just eating a few more vegetables every day can make a big difference. Mix up some psyllium husk if you didn't think you got enough in. And so it's a really empowering message. And I love that the education is coming from all of us. It's not this one direction.
Excellent, thank you. And I know we have some questions coming in for you. Everybody who has questions, please do submit them into the questions panel. So I just want to say you have a captive audience here of natural products industry professionals throughout the supply chain, from the ingredient suppliers, the brands, and the retailers. And so these are the professionals, people who come to an event like this. These are the people who are really taking time to, stay on top of the science, the trend, the regulatory issues. So you're talking to the responsible players, right?
Yes.
So what would you like to see from this industry to help us all work together towards that collective goal of educating and promoting wellness? What do you want to see from natural products side?
Well, thank you for asking me, Maggie, because it really is a wonderful opportunity to address this, incredible community of professionals. I would like to see more education about diet and lifestyle alongside the supplements. There's no question that many of these products can make a tremendous difference. I myself use a ton of psyllium husk, acacia fiber, magnesium, things like this in my practice, but it's always I'm literally giving people, the written instructions for their psyllium husk and then telling them, yes, and I want you to make sure you're drinking half your body weight in water because you need to stay hydrated. Otherwise, your digestive pipes are going to get clogged. I'm telling them how much magnesium I want them to take while I'm giving them my green smoothie recipe. And I think the same is true for the conventional pharmaceutical industry too, is that if you do these diet and lifestyle things in concert with whatever else you're taking, you're going to get a better result, and you're going to have a happier consumer, and you're going to have a more loyal client at the end of the day. So I'd like to see educational campaigns that involve the diet and lifestyle things, maybe something as simple as drinking more water, along with the products. And I'd also like to see products that actually look like food. There was a great article last year about the effects of prunes and kiwi. I believe it was an Australian study, and it found that prunes and kiwi were more effective at relieving constipation, even constipation predominant irritable bowel syndrome, and had less bloating than things like Miralax. And so I immediately I do eat a ton of prunes and kiwi. I've been married long enough that, a little gas is not a big deal in my household from the prunes. And I tried to dehydrate the kiwi and chop up the prunes. And I was trying to make these dehydrated kiwi prune bars. I'm not a professional at that. I'm very good at doing colonoscopy. So it was a bit of a disaster. But I'd love to see more products that actually have, not just a processed version of the food, but the actual food, like a food as medicine product. I'd love to see skin products that are edible. We have that already, but not in a huge way. And again, I'm a big fan of mixing up a vat of coconut oil and manuka honey and various things, because our skin is our second largest digestive organ. Everything we put on it is absorbed into our body. And it's also an organ of excretion. So it's how we release toxins. We already have some incredible products in those areas, but I'd like to see more and more education about what you can do in addition to taking this product, along the lines of, the educational process about the whole journey, not just the product. And again, as I said, I think that there are lots of companies that are doing that and doing a great job of it.
That's excellent feedback. Thank you so much for that. All right, let's see. I'm going to get to some of these questions that we have coming in. We have a question from David here. Has the research touched on the area of high variability with stool analysis, with different labs producing vastly different results with the same sample?
Yeah, David, you make a really great point there. We are in the infancy of microbiome analysis. And I worked with one of the early players on the market, Ubiome, when they first had their product. And we sequenced about 2,000 patients. And basically, everybody who came in the door of my practice, I handed them a kit. And I was particularly interested in the inflammatory bowel disease patients, because being able to describe a microbial signature, which we have really for Crohn's disease, is a really helpful diagnostic tool. But what I found is for the individual patient, it really didn't make a difference. I mean, for example, we would see high levels of proteobacteria, which are typically high when we're younger, but as we get older, high proteo is a marker really of sort of pathology, if you will. So I would see somebody with, a tremendously high when we look at the typical families of Firmicutes, Bacteroidetes, et cetera. And I would see high proteo, and they would say, well, what does that mean? And I would say, well, it means you have inflammation, which I've known for 11 years when I diagnosed you with inflammatory bowel disease. It's just validating that. And they would say, well, what should I eat? And I would say the same things that that we know will help to deal with inflammation. So this idea that you can really be super prescriptive, we're not quite there. And in part because we're still primarily measuring the species, not the metabolites. And also because there's adaptation. So it's not always possible to tell whether what is being produced is cause or effect. So we're getting there. And obviously we have to kiss lots of frogs to get there. But I don't think we're really at the point where we can use these tests in a super predictive way, other than if you think about like Enterococcus faecalis, you can identify that with a simple mouth swab. And that may be a way to stratify people and say, hey, you have high Enterococcus faecalis, you're at higher risk. Maybe you need to, need to think about your quarantining and your social distancing a little bit differently. And by the way, like, let's work on getting that number down by increasing the amount of F. prosnitzii, et cetera. So I think the same thing when we look at like mucins, a protein in mucus, we can stratify. We know that some people are super spreaders and some people are super recipients based on the quality of their mucus and the mucins, the proteins in the mucus. And that may be a way also for us to stratify people who are at higher risk, just like we do it in the OBGYN world. When we do a cervical exam, we feel the mucus and we feel that somebody's mucus is thinner, we know that they're at higher risk for preterm labor and delivery. So I think there are diagnostic things that we can use to stratify people and to assess risk.
Excellent, thank you. Question here about, you mentioned the American Gut Project study. Were any issues found with those who consumed FODMAP veggies or nightshade, or did the diversity of the vegetables combat any potential issues?
Yeah, it was really diversity trumped everything. And of course, that study didn't look at tolerability. That's a different study. And so the irony is that, remember, the FODMAPs diet was developed as a diagnostic diet, not a therapeutic diet. So it was developed as a diagnostic diet to decrease bloating and, really gastrointestinal distension. And it does give you that answer. But a lot of those foods that are very gas producing that are eliminated on a low FODMAPs diet are actually foods that can be really helpful for reconstituting the microbiome. So there you have to balance tolerability with what your long-term goals are. And, there are all kinds of tricks to do that. You go slowly, you make sure, if you're eating beans, that they are soaked and they are not canned beans, that they're fresh and you're soaking them. You can cook them with a sea vegetable, etc. But I remind people that not all gas is bad gas. I mean, gas from lactose intolerance, where you're eating dairy and you shouldn't be, or gas from, rotavirus infection, but gas from eating Brussels sprouts or prunes or cauliflower is not necessarily a pathologic type of gas. But again, to answer your question, it was just looking at the health of the microbiome. It wasn't looking at how people tolerated it in terms of the different ones.
Excellent. Okay, thank you. We have more questions that we didn't get to, but perhaps we can connect some of those questions to you later. We have covered so much ground, learned so much. Thank you, Dr. Chutkan. We're looking forward to the release of your new book. And so everybody knows that is available for pre-order now. So you can go in and claim your copy for when it comes out. So thank you for joining us.
Wonderful. Thank you so much for having me and for all the great work you're doing to keep everyone well informed.